today we have so many different implant types available, it can seem very overwhelming. So let me just cover a few of the basic things about breast implants. So initially, you may think about having a saline implant, which is filled with salt water and has a smooth, or we can also have potentially a textured shell, or you can go with a silicone implant. Now, they both feel very different. Saline's going to be quite a bit firmer and possibly have more of these ripples. Also, when this one springs a leak, it's going to deflate or go flat. A silicone implant is going to feel much softer, like a natural breast, and the gel that's used inside the implants these days is thicker than the old implants from the 70s and the 80s, and the shells have become quite thicker. So there are a variety of different implants that have various degrees of what we call cohesivity, or the thickness of the gel on the inside. Now, another thing that you're faced with is the selection of profiles, and having that option of different profiles is great because not everybody is not after the same thing, and every body type is very different. Now, these 3 implants are all from the same company, and they are all the exact same volumes. This is a 325cc implant, and this is a 325cc implant. So you can see these are very different when they come to the diameter and also to the projection. So when a wider based implant is going to be inside someone, they're going to get more volume up here to the top, a more gradual slope, and not as much projection. An implant that's a high profile implant like this is going to have less volume at the top and then come out more lower. So we tend to pick and we also have this one in the middle too. So we tend to pick the profile that fits the patient's anatomy based on the volume that they're looking for. So the big mistake is coming into this process knowing what profile you want first, because if you have that idea in your head, you're probably going to potentially go down a wrong path. So be open to various implants. Once we find the volume that you like, we will help to give you advice on which profile is best suited for your individual anatomy. We also have anatomic or teardrop-shaped implants, and these vary significantly from company to company, but we have a number of different sizes, projection, and base diameters and heights that people can choose from. So this becomes a very specific type of implant that we will go for, that is really geared specifically for what your body needs in order to achieve your goals.